I would like to introduce you to our presenter, Sheila Goertemoeller. Dr. Goertemoeller is a clinical toxicologist certified by the American Board of Applied Toxicology. For nearly 30 years, she has directly managed thousands of overdoses on the poison control hotline of the Cincinnati Drug and Poison Information Center that serves a population of approximately 6 million in 24 counties in the state of Ohio. In her role, she prepares toxicology monographs, guidelines, and literature to enable standardized clinical treatment plans for overdose patients. She's a toxicology consultant for heightened overdoses and takes on the challenge of researching in-depth drug information questions. So she'll be a great resource for us. She has an interest in addiction and substance use prevention and is certified by the Ohio Chemical Dependency Board as both an Ohio Certified Prevention Consultant and an internationally certified prevention specialist. She has regulatory experience in legal poisoning consults and has worked closely with both the FDA MedWatch safety reporting and the Environmental Protection Agency's toxo-surveillance programs. She proudly serves on several national committee roles in toxicology societies, including America's Poison Centers, Specialists in Poison Information, American Academy of Clinical Toxicology, and the American College of Medical Toxicology. Dr. Goertemoeller holds a faculty position as an adjunct assistant professor of pharmacy practice and administrative sciences at the University of Cincinnati, James L. Winkle College of Pharmacy. She has authored over 50 toxicology publications, over 100 toxicology newsletters and blog topics, and serves in an editorial role for the department newsletter and peer review colleagues' publications. She is certified in emergency management response to chemical and biological warfare, and has an interest in naturally occurring toxins and historical poisonings. Her true passion is teaching others to love toxicology, and we welcome her here today.
Thank you so much for the introduction, and thank you for this opportunity to talk about such an important topic in our communities. Hello, everybody. I'm Sheila, and my objectives today are to cover these 2 points, is to discuss the ways in which both nicotine and cannabis are used together by our youth, and also to talk about prevention efforts that may be more impactful when both of those are used together. And I really appreciated the lectures done by both Dr. Ashley Marianos and Courtney Calvin, who talked about the landscape of youth vaping and the various vape products and prevention efforts in that regard. Before I zoom in, I want to zoom out for just a second and just talk about I work for one of 55 poison control centers in the nation. And if you pool all of our data, all 55 poison control centers data on e-cigarette and liquid nicotine exposures, this is what it looks like. So I'll let you just kind of take a minute to absorb this graph. So you can see that back in 2011, we really didn't get very many hotline calls on this, but you see that first peak in green around 2014. This was really the first year that e-cigarettes became the most commonly used tobacco product, reportedly used by our US youth. And then you see this second kind of spike in 2019 in blue. And this is when the Juul products became more popular. The fruit, mint, and candy flavored vapes became popular and were heavily marketed. And also, this is when the rise of the THC oil cartridges happened. And I do want to point out that this is across all ages and not just our youth. So you all know that there's various formulations in which both nicotine and cannabis are used together. And today's lecture, I'm going to be focusing on vaping of both of these products together. It's somewhat well known, I think, that nicotine and cannabis addiction share a common sort of genetic risk factors, and using them either together or in succession can increase the severity of withdrawal symptoms. It can hinder cessation efforts because now we're dealing with two things instead of one. In terms of what goes into these products and what comes out, it's not the same thing. So, in terms of what goes in, yes, it can be nicotine, it can be THC or CBD, it can be things to kind of flavor it or sweeten it or solvents. So, things like um, uh, PG or VG can all be added to kind of make either a cloud or to uh, make it taste better. But in terms of what comes out, can be some harmful things. So this could include things like heavy metals, things like chromium and lead and tin. It could have some volatile organic compounds and things that can cause cancer, like benzene and formaldehyde. And I also want to point out that, we call it vaping, but it's really truly not a vapor, it's an aerosol. So vapor just means that a substance is suspended in air. So think of something like water. When it's heated, it's still water, but in a vapor form. Whereas this is truly an aerosol because there's residue in it. There are fine particles that are in it. So I think, calling it vaping kind of almost minimizes the risks. But for the purposes of this lecture, I'll continue to call it vaping. But it is truly an aerosol. Before I get into the nitty-gritty of vaping, I just wanted to do a quick touch base in terms of definitions surrounding cannabis because I think it can be a little bit confusing. So, cannabis is the plant that has many, many, many chemicals, of which over 100 or so are called cannabinoids. The most well-studied cannabinoids are THC and CBD, with THC being the psychoactive and the CBD being not the psychoactive compound. And it's called cannabinoid because it just so happens that in our body we have an endocannabinoid system of receptors and chemicals. And it just so happens that these chemicals in the cannabis plant work on those receptors, hence the name. So that's kind of how it came about to be called cannabinoids. So let's talk about nicotine vaping. So when it comes to nicotine vaping, it all starts with the Nicotiana plant, from where they extract nicotine and use it in various vape products, which we then go on to inhale. And it is absorbed into the bloodstream and reaches various organs from our lungs to our heart, our brain, and our immune system. And with cannabis, similarly, it starts with the cannabis plants where they extract the various cannabinoids, including THC, which is then used in the THC vape pens, whether in a solid form or in a liquid form, or the plant material, which is subsequently vaped and can cause some of the psychoactive effects that we associate with cannabis. But back in about 2019, there was an outbreak of something called EVALI, which is e-cigarette vaping associated lung injury. This really made the news. There was a lot of, good health information that was put out by the CDC on this topic. And this is a lung condition, and you can see that there's like popcorn in the lungs, which is kind of what we called it because that's kind of what it was doing to the lungs, causing this kind of inflammatory reaction almost resembling popcorn in the lungs, where people who are using the THC vapes went on to develop these horrible lung symptoms, including shortness of breath and cough and chest pain, to the point where, gosh, there were thousands of people who were hospitalized. There were over 2,000 people who were hospitalized from it. And ultimately, this was all linked to something called vitamin E acetate, which was used as a thickening agent in these THC vape pens. And this ingredient is really a safe ingredient if used appropriately. It's in cereals and vegetable oils, but it is not meant to be vaped. So it was causing all this lung injury. And this was one of the first cases of EVALI was actually in a teen who was vaping several times a day, both THC and nicotine, and went on to develop lung injury. There were actually several fatalities attributed to this, over 60 fatalities in all 50 states across the US. So we know a little bit about cannabis, we know a little bit about nicotine vaping, but what happens when they are both used together? Published studies on this show that using them together is associated with greater psych disorders, poor functioning in emerging childhood. Excuse me. So some of the effects in terms of using both of these together, it can amplify our reward and addiction pathways because they can both affect a chemical in our brain called dopamine, which is involved in our reward system pathway. When they're used together, they activate the brain's reward circuits, increasing the pleasurable effects and making addiction more likely. So, adolescents who vape both substances are at a significantly higher risk of developing dependence when they're used together. They also increase our cognitive impairment, meaning it can affect our thoughts and our senses. So, using nicotine in the short term in low doses can improve attention, but using them long term can impair brain development. With cannabis, it has more of a dose dependent effect on cognition, especially in terms of our working memory, executive function, and with learning. So using them together suggests really studies show that using them together can lead to more severe and persistent impairments, especially in the developing adolescent brain. Heart risks. So nicotine is a vasoconstrictor, meaning it narrows our blood vessels and can lead to increased blood pressure and heart rate. Whereas cannabis, particularly THC, the psychoactive component, can cause increased heart rate and it can cause fluctuations in our blood pressure. So you have two things affecting the heart in slightly different ways. Using them together can pose a significant strain on the cardiovascular system, especially in young adults with developing cardiovascular systems. Heightened respiratory risks. So I think everybody knows that, vaping is not good for the lungs. That's not what the lungs are, meant to take in. So both of these have irritant effects on the lungs, and using two different chemicals with all these other solvents and things that go into it certainly can increase respiratory risks. I briefly talked about EVALI earlier, but it can also cause things like bronchitis and decrease our lung function. So cross-sensitization and mental health disorders. So really what this is saying is that cross-sensitization can occur when one exposure to one ingredient can enhance the sensitivity to another. So in this case, with nicotine can sensitize the brain to the psychoactive effects of cannabis, making one more prone to experiencing things like anxiety or paranoia or even psychotic symptoms. There have been a few studies done in this regard, and I just heard that there is an article that is hot off the press that came out yesterday that's not included in my slides. But in this paper, this study really established that there is an inflammatory reaction that happens in the lungs that's induced by cannabis, specifically CBD aerosol inhalation, and that was greater than that caused by nicotine. They talked about how these chemicals can affect the pulmonary lung barrier integrity and cause lung damage. And in this study here by JAMA, this was a qualitative study of online videos, and they found that there was high frequency of statements about health benefits from vaping cannabis or frequent purchasing links and sites with sort of inadequate age restrictions, especially on social media platforms, can increase the risk of cannabis vaping among our youth. In this paper here, they talked a lot about co-use of nicotine and cannabis and how that can increase various health risk behaviors. In this study, in terms of dual use of nicotine and cannabis, they try to measure the relationship between nicotine and cannabis vaping among 1,800 plus adolescents from 4 different public high schools outside of Philadelphia and Pennsylvania. And they found that from middle to late adolescence, vaping of both of these really developed in fairly close parallel. And JAMA is one of my favorite um, magazines. So in this JAMA paper, they looked at over 3,000 youth, and they found that youth in trajectories reflecting more frequent nicotine vaping had a higher probability of also being in sort of that higher cannabis use trajectory. What can we do about all of this? So our previous speakers did an amazing job of talking about prevention and resources already, but I wanted to highlight 2 things once again from JAMA. So in this JAMA randomized control trial, what they did was they looked at a population of adolescents aged 13 to 17, and they did an online survey. And what they did was they basically put youth in sort of these 3 different categories, where there were 504 or so of them, where they viewed 3 investigator created neutral videos about vaping. So it wasn't like a positive or a negative thing. And then they put some in a group where they viewed videos on the health harms of vaping, and then others, the rest, viewed videos about addiction consequences of vaping. So what they found was that those who viewed the real cost video or just anything that had to do with the health harms related to vaping had a much lower susceptibility to vaping subsequently. So all this just to say that talking about prevention, talking about the health risks have a positive impact in adolescence. This was another prevention effort done in a slightly older population, so 18 to 24-year-olds, where they looked at 2,588 individuals who, again, once again, this was a randomized clinical trial where they did sort of kind of split them in half, and about half of them did monthly assessment of e-cigarette use and abstinence via sort of an incentivized text message, which is, I think, text messages are definitely a good way to communicate with, um, you know, the younger generation. And then in terms of the other half, they did more of an assessment only control. Plus, they also did an automated youth tailored interactive text message. And basically, what they found was that those who received the quitting intervention had a significantly higher vaping abstinence compared to those who were in the control group. So once again, sort of highlighting that prevention messages and giving them resources and talking to them about the dangers of vaping truly have a role in helping achieve quitting, which is a good goal for anyone who has who's vaping. So I do think that when it comes to this topic, it does take a village. So we have done podcasts on this topic, several blogs and newsletters. We certainly get calls on this topic, whether it is in adolescent vaping, whether a vape was left at home and a younger child comes along and takes a sip of that vape and now has nicotine toxicity or THC toxicity. I mean, it really does truly take the village of all of us to talk about these dangers and bring our community together. Here are my references, and I'm happy to answer any questions.
All right, thank you, Dr. Goertemoeller. This is wonderful information. Gosh, I wonder if we called it aerosoling instead of vaping. I
Yeah.
hadn't thought about that until today.
I feel like aerosoling just doesn't, flow off the tip of your tongue like vaping does. And I do think that calling it vaping definitely is a misnomer and suggests it's a little safer than what it truly is.
Agreed. Yes, very, very interesting. And we will come back for questions during our discussion portion of the session. But just thank you for sharing. Really appreciate all of the insights and the research articles as well. So we will work to pull some of those and add them to the iEcho platform where you can go and access them as well as attachments. And certainly your presentation is available in the iEcho platform, and we will have notes with resources, and anything that is put in the chat, we will capture and add those to the notes as well. So we really hope that everyone walks away with a lot of information